This is Mike 6, evaluate and treat a casualty for a spinal injury and shock. This is Specialist Barrera. He will now have 1 minute to correctly identify at least 6 signs and symptoms of shock.
Blotchy blue skin, thirst, nausea and vomiting, pale skin, sweaty but cool skin, and confusion.
Here we go. Step 1, apply cervical collar. Have the other soldier kneel at the casualty's head and manually apply inline stabilization of the head and neck. If the assistant is notional, the grader will state the other soldier has the neck and head and neck inline and immobilized. Reassure the casualty and explain the procedure to him or her.
It's gonna be okay. There's a spinal injury. I'm gonna apply a C collar on him.
Measure and determine the size of collar to apply. The front height of the collar should fit between the chin and the chest at this suprasternal notch. Once in place, the collar should rest on the shoulder girdle and provide firm support under both sides of the mandible without obstructing the airway or any ventilation efforts. If the collar is too large, the casualty's neck may be placed in hyperextension. If the collar is too small, the casualty's neck may be placed in hyperflexion. Size the collar based on the manufacturer instructions. Apply the collar to a supine casualty. Ensure the other soldier maintains inline stabilization. Set the collar in place around the neck. Secure the Velcro strap in place. Maintain manual stabilization of the head and neck until the casualty is immobilized on a long spine board. If the assistant is notional, the grader will state the other soldier has the head and neck immobilized. Immobilize casualty to spine board using straps and head immobilization blocks or improvise. Assess for shock. Assess casualty's level of consciousness utilizing AVPU.
Hey, can you hear me?
Grader will state casualty does not answer but reacts to pain. Evaluate skin. Grader will state skin is pale and moist, abdomen is distended. Assess capillary refill on a finger. Grader will state capillary refill takes 4 seconds. Check for pedal pulse. Skin to skin, no thumb. Grader will state you do not feel a pulse. Check for femoral pulse. Skin to skin, no thumb. Grader will state you do not feel a pulse. Check for radial pulse. Skin to skin, no thumb. Grader will state you do not feel a measurable pulse. Check for carotid pulse. Skin to skin, no thumb. Grader will state you feel a weak but rapid pulse.
Monitor for 30 seconds.
Measure pulse for 30 seconds. Skin to skin, no thumb. Grader prompt. 30 seconds has elapsed. Assess respirations utilizing the head tilt chin lift method. Grader will state respirations are rapid but shallow. Measure respirations for 30 seconds. Grader prompt. 30 seconds has elapsed. Treat for a hemorrhagic shock. Position the casualty. Move the casualty under shelter to shade him or her from direct sunlight. Note, secure casualty to the litter before moving. If no assistant is available, candidate will verbalize but still ensure to secure the casualty on the litter. Maintain supine position and spinal immobilization. Loosen clothing at the neck, waist, or anywhere it is binding.
Doing buckle.
Prevent the casualty from getting chilled or overheated. Using a blanket or clothing, cover the casualty to avoid loss of body heat by wrapping completely around the casualty underneath the litter straps. Re-secure the patient on the litter. Calm and reassure the casualty. Watch the casualty closely for life-threatening conditions.
Okay, I'm gonna continue monitoring for any life-threatening conditions.
Correctly record all treatments on the front and back of the TCC card.
Evac, urgent, date, day, month, year, time, Lima or Zulu, mechanism of injury, fall, mark injuries, hex on spinal, time with Lima or Zulu, monitor rate, pulse, respiratory rate, and AFPU. Evac category, urgent, Bravo line, O2, other, C collar, name, last first, last four.